السلام عليكم ورحمة الله وبركاته متابعينا عبر صفحة أسواق على فيسبوك ويوتيوب. بنرحب فيكم مرة تانية ببث مباشر مرة أخرى لطرح مواضيع بتهمكم، مواضيع صحية اجتماعية وما إلى ذلك. موضوعنا اليوم وبث المباشر مع دكتور محمد إقبال محمد سروار، هو استشاري في طب الأطفال في مستشفى KPG دمنسارة التخصصي. اليوم موضوعنا رح يكون حول موضوع الربو وارتباطه بفيروس كورونا الجديد COVID-19 مع الدكتور محمد إقبال. Doctor, thank you so much for being with us today.
Thank you for having me. It's an honor.
Thank you so much. Doctor, can we start from asthma in kids, which is the main topic of this talk? What are the reasons? How does asthma happen with kids? Can you explain more for us about asthma as a disease that...
So asthma is a chronic, which means long-term, respiratory problem that affects children and adults. In asthma, there is tightening of the airway. So the child, sometimes they have problems with breathing. They have difficulty in breathing and they have wheezing as well. Mm-hmm. And it's thought that in asthma, you don't, it's not an infection. You are born with certain characteristics that makes you more inclined to get asthma as you grow older.
What you meant is specific characteristics or reasons that you are born with. Is it in the genetics? Is it in the respiratory function? So what is the
in asthma, the main issue is your airway is very sensitive. Mm-hmm. So certain triggers makes your airway tight. And because your airway is tight and more narrow, you have problems getting oxygen and air into your lungs. So that in that situation, you have problems breathing. And it's thought that this is probably have a very strong genetic component. So a lot of children who have asthma have a genetic probability of developing asthma. And it's thought that these children who have this genetic probability also are inclined to have other illness within the same umbrella as asthma. And this include things like eczema, allergies, rhinitis. These conditions are termed under the umbrella of atopy, A-T-O-P-Y. And again, there's a very strong genetic component in this illness.
So you said it's genetic. There's genetic reasons behind this.
So disease. It's not like pneumonia. Pneumonia is an infection.
Okay.
So you get pneumonia from an outside agent, a bacteria, a virus that attacks your lung, damage your lung, and then you get the pneumonia. Whereas asthma is in your lung itself. It is how you are built up, how your lungs are very sensitive, triggering inflammation when it's exposed to certain stimuli. And this can be as simple as dust, change in temperature. Virus and bacteria can also be stimuli to trigger asthma, but it is in your inert self. You have those susceptibility in you due to your genetic makeup.
Doctor, for you as a pediatrician and neonatologist, how do you deal with kids who have asthma? Is there a way to treat it? Is there a way to deal with it so the kids will grow up normally or have less health problems in the future?
So I think asthma is common, right? Especially in children. And it's thought from research that the incidence is increasing. Why is increasing? We don't know exactly. There are many theories. One of the theory is the clean living theory, the clean hypothesis. It is thought that because we are living more cleanly, our body is not exposed to viruses, parasites, bacteria that now normally can condition ourselves to protect our body against developing hypersensitivity. we have seen an increase in the incidence of asthma. In the Middle East, for example, there is an increasing prevalence of asthma. In Saudi, about 24% of children thought to have asthma. In Oman, it can be as high as 20%. In Qatar, 20%. And the burden of asthma is a lot, not just in terms of illness, but also psychological and also problems with missing schools. So when I see children with asthma, my main role is to educate the parents, because asthma is a long life condition. You don't get cured from asthma, you manage it. And it's very important that parents know what causes asthma, how to treat it, how to manage it, so that the symptoms in the child can be minimized. So the aim for me as a pediatrician is to minimize the disruption of asthma on the child's social life, minimize the disruption of asthma from the child's school life, so that it can live a normal life. There's also a lot of myths surrounding asthma, and that's my role, to try and break down this misconception. There's a lot of misconception saying asthma is a condition that people outgrow from. Actually, you don't outgrow. You manage it, it gets better, but you still have that predisposition, and that you can still have an asthma attack at any time. So it's very important that parents are aware that just because your child hasn't got any symptoms doesn't mean the child has cured. And also, you also need to know that not all cough, not all wheezing is asthma, because it's very common. A child cough, doctor, my child had asthma, help. So you need to know what is asthma and what is not asthma, and that needs detailed examination, detailed taking of history, and interaction with your pediatrician and respiratory consultants. In terms of management, it's very important that they know what medicine is used to relieve symptoms and what medicine is used to prevent symptoms. And also, I tell my patients, okay, we talk about drug type of management, but there's also management that doesn't use drug. How to make the child healthy so that they can live with asthma better. And this can be as easy as make sure that the parents don't smoke. Smoking is very bad. Even if the parents say, I don't smoke at home, secondhand smoking, third-hand smoking can aggravate the symptoms of asthma in the children. Exercise, obesity. Obesity makes asthma worse in children. So we want them to exercise. We tell them just because you have asthma, it shouldn't prevent you from living life as normal, participating in sports. We encourage that. And sometimes, in order for them to do the things that they want, they may need certain medication, and that's where I come.
Okay. Doctor, if I, as an adult, I have asthma, let's say, what are the chances of me transferring this disease to my children through genetics?
Okay, so we don't understand the exact genetic mechanism of how in some families, you'll have mother who has asthma, father who has asthma, and then the children totally fine. We have conditions like that. But we know if there is a parent, one or even two, it will increase the risk of asthma in the child. Whether that will definitely happen, we don't know. So if you have asthma as a father, and your mother and your wife has asthma, then you need to be aware that there is a slightly higher risk of your child developing asthma too. So you have to be careful. Don't smoke. Practice good hygiene, good eating habits, good exercise, so that you can protect your child from getting bad asthma.
Doctor, normally many people say, you just mentioned smoking, secondhand smoking, and if I am a smoker, let's say if an adult is a smoker, you mentioned that they say, I don't smoke in front of my kids. I don't smoke at the house, maybe. They smoke outside. But when they get close to their kids, maybe they kiss the kid or talk to them close, face to face. How does that affect the kid? How does that transfer germs, maybe, or viruses from the adult to the kids?
So secondhand smoking and this thing that we now know called third-hand smoking is a very serious problem. There has been research to look at the level of nicotine in the hairs of a mother who doesn't smoke. They take the sample of the baby who is in the family, in a family whose father smoke. When they did the analysis, they found that the level of nicotine in the baby is higher than the level of nicotine in the mother. So why is that? It is thought that with the children, with babies especially, when the father smokes, the baby will be exposed to secondhand smoke from the father. And the baby also has a higher risk of getting bad exposure because they are immobile. They cannot move. So they just absorb all the smoke into their lungs. Whereas the mother, although she doesn't smoke, she's mobile. She moves around. That is why research shows in a family whose father smokes, the risk to the children is higher than the mother. And also, we now know this new condition called third-hand smoking. When the father smokes, the smoke, the nicotine settles down and stick to the surfaces of the house, stick to the surfaces of the clothes. When the father comes and kisses the baby, the nicotine and the noxious stuff from the smoke cigarette goes into the child's toys, into the child's clothes. The child then take these toys, put this in the mouth. That increases the exposure of these horrible things in the cigarette to the baby. So it's very important that if you have a risk of asthma, you don't smoke because you can also at risk because smoking worsens your own asthma and it can also triggers bad asthma in your children.
Doctor, let's move to COVID-19, which is the talk of the hour for the last maybe 6-7 months. The whole globe is talking about this. We hear a lot that children are the less group infected with COVID-19. For some reason that scientists are still researching, the number of infections in children less than 5 years old is still very, very low compared to that of adults.
True.
What do you think is the reason that infections in children is way lower than adults?
So the scientists are still not sure why with this coronavirus, the COVID-19 is the disease. The actual virus is called SARS-CoV-2.
Correct.
Severe acute respiratory virus, coronavirus 2. So we know from research, epidemiological studies, from statistics that children are less affected. There are many theories to postulate this. One of the most common and popular theory is the fact that in children, on the surface of their body, they lack certain receptors that are more prevalent in adults. These receptors are important to encourage the entry of this virus into the cells. And it's thought that these receptors are also important in triggering the inflammatory cascade that results in the severe infection. So it is thought that in children, because they are more immature, they don't have these receptors, hence they are less affected. There's also other theories to say that perhaps children are less infected because of their lower immunity. Because with coronavirus, when they have severe pneumonia, when they have the SARS-like illness, the severe acute respiratory infection, what happens is the infection attacks your lung, it stimulates your lung to produce severe inflammation. For that to happen, your immune system needs to be very mature. In children, it is thought that the immune system may not be mature enough to trigger this cascade of inflammation. Hence, the children are less affected. But, wallahu alam, the actual reason we still don't know.
Okay. Doctor, we have a lot of situations where a whole family is infected, especially the mother, who might be breastfeeding her child. So we saw cases that where a mother refuses to leave her child, she wants to breastfeed him. Is there really a healthy way or a realistic way to breastfeed the child without risking infecting him with the virus if the mother is infected with coronavirus?
So with infection to the baby, we know that there's probably little risk of baby getting the virus from the breast milk, right? The actual sucking on the breast to get the milk into the baby probably do not transfer the virus from mom to baby. It is thought that the risk of transference of the virus from mom to baby is due to the droplets.
Mm-hmm.
So, for example, if mom was coughing, mom has got runny nose, mom touch the nose and touch baby. That's where the transference of the virus occur. Advice on how to avoid this is still uncertain. The official advice from WHO and a lot of the International Pediatric Association says it's safe to breastfeed a baby whose mom has got coronavirus as long as the mom wears a mask and also wash the hand very thoroughly and avoid touching baby unnecessarily. So very, very careful. In Malaysia, for example, we take a... Hello?
Yes, doctor, we can hear you.
In Malaysia, we take a different view, and the Ministry of Health do not advocate breastfeeding because they tend to be a bit more cautious. So different countries will have different policies that they have regarding breastfeeding. As I said, the official line worldwide is yes, you can breastfeed, but you have to be very careful because you can still transfer the virus from you to the baby through your droplets, not through your breast milk. In Malaysia, we do not encourage breastfeeding.
Doctor, we hear a lot also about the underlying, as they say, underlying diseases or underlying health situations in people who succumb during to COVID-19. We hear a lot that the highest risk group, as you mentioned, respiratory diseases, heart diseases, people with diabetes and all this. So one of these high-risk groups is people with asthma in adults.
Yeah.
Adults who has asthma as well, who have asthma are one of the high-risk groups. When it comes to children, are children with asthma considered a high-risk group when it comes to COVID-19?
Yes, they are, especially if their asthma aren't well controlled. So it's very important in this day and age that we protect our children from any respiratory problems. So if the child has asthma, this is the time to see your doctor to control your asthma the best that you can. And you may need to use medicine, inhalers, nebulizers to control your asthma so that the child's lungs are at the most optimal condition. Also, this is the time, in terms of prevention, think about vaccination, especially children who's got respiratory problems like asthma. So in our vaccination, you have certain vaccines that protect specifically against respiratory infections. Unfortunately, we still don't have the vaccine for coronavirus. Hopefully, at some point in time, that vaccine will come through, but that will take time. At the very at least we now have other vaccines that can protect, especially children with asthma. So you have the influenza vaccine, you have the pneumococcal vaccine, and also you have the DTaP vaccine. The DTaP vaccine contains protection against whooping cough. So all these are respiratory virus, respiratory infections that may make your lung worse. So if your lungs are bad, then you have a higher risk of getting the bad coronavirus infection. And in this day and age of social distancing, we have to be aware that in matters of vaccination, you need to come to hospital to get your child vaccinated. I've seen parents who are so afraid of going out, they go to the extreme of not vaccinating the child. So the child gets sick from other illness. So you want to avoid COVID, but you expose the child to other things. For example, meningitis, severe pneumonia. That is not directly COVID related, but the child gets it because the parents forget or do not want to vaccinate your child. So do not leave your vaccination.
Doctor, you mentioned the vaccination, which is also a big talk actually. Before we had all this coronavirus, we saw in the last couple of years this discussion that many people claim that vaccines and vaccination of children might have a helping factor in causing autism. You hear a lot of discussion about that. I know that many people in the science community, they refused all these claims. They proved that it is wrong. But we still see that even in 2020 now, we still have cases of polio in Sabah, in the east of Malaysia. It's appearing again due to people not vaccinating their children. So for you as a doctor, can you just maybe clarify to people this myth or this claim that vaccination have a role in causing autism in kids, and why is it true or not true?
So this myth, this misconception about vaccination causing autism has been around even when I was in medical school. It was started by a very defective research, false information done, which found which claimed to find a link between autism and the MMR vaccine. Now, that was one research. Subsequent to that, the journal that published the research realized that the research was done not in the proper way. It was done fraudulently. So the research was pulled out. And the investigators of the paper has been disbarred from practicing medicine because of their unethical practices. Since that research came out, there have been many research to investigate the link between autism and this vaccine called MMR. No, not even one single research has proved a link. And that has proved that there's actually no link between autism and MMR. And in the world today, there's not even one government that has banned the use of this vaccine. So no government in the world wants to poison your child. So when the government makes a policy, they will look at the evidence available to make sure that the vaccine that they give to your child is safe. So all the evidence that we have now has proven that this vaccine is safe, doesn't cause autism, and should be given, because if you don't give this vaccine, the child will get very bad illness. Measles are coming back. Pertussis are coming back. And we talk about coronavirus, right? Coronavirus is infectious. It's got an RO score of about 2 or 3.
Yes.
Measles are even more infectious.
Correct.
It's thought to have an RO factor of 19. How much more infectious is measles? Why don't we see that many measles now? We don't see it because of vaccine. If we stop giving vaccine, it will come back. children will die. Children will be disabled because of this measles infection. We do not want that.
Okay, doctor, let's go back to asthma. As you mentioned, you said that many people will, if he will have his kid coughing or sneezing for about a couple of times, they will run to seek medical help because they think their kid have asthma. Can you help us and help all parents? How do I differ if my kid is having a normal cough or some kind of allergy or something, or if my kid could be having asthma? How do I know before I seek medical help?
Okay, so coughing itself is not a problem. It's not pathological. Coughing is physiological. Your body coughs for many reasons to clear your airway. So sometimes a child may have a bit of phlegm, they cough, they get rid of the phlegm, fine, khalas, the child settles. So a cough that is problematic is a cough that happens recurrently, again and again. A cough that is problematic is a cough that is associated with other symptoms. For example, breathlessness. The child is breathless. The child is wheezing. The child has fever. When these associated symptoms are present, see a doctor. The doctor can then examine your child, take a history, and determine the actual cause of the cough. As I said earlier, not all cough is asthma. Sometimes the child may be coughing for other reasons. Unfortunately now, for children, we don't have a good test to diagnose asthma. So most diagnosis of asthma is from history from the parents, pattern of presentation, and the examination of the child by a doctor who knows how to deal with asthma. And also fourthly, diagnosis of asthma is based on the response of the medicine that the doctor gives to the child. So it's very important that if the child is coughing with these red flags, fever, breathlessness, wheezing, cough that disturbs the child's normal activity, do go and see a doctor for checkup and for clarification. Because if it's asthma, the medication is this. If it's not asthma, the medication is this. So there's no one medication that treats everything. There's no such thing as a cough syrup. This thing about cough syrup is a myth that we need to get out of the system. There are different types of cough medicine that do different things. They can be as simple as a syrup to ease the cough. These are mainly herbal based. Sometimes you cough, you take a medicine not to cure the cough, but make you feel a bit better. There are also other medicine that actually treat the root cause of the cough. Again, what medicine you need to see the doctor for clarification.
Doctor, for kids or pediatrician, for you as a pediatrician, what is there levels for asthma in kids? Is there some kind of severe cases or cases that are that can be manageable more than other cases? What are the differences between levels?
We are still okay. Asthma is common, and there's a lot of awareness about asthma in parents and also doctors, right? But despite this, people are still dying from asthma. We are still seeing children who die because of asthma, and for me, this shouldn't happen. And when you look at the case studies of children who die with asthma, it's because of poor control. Sometimes parents, they go to see one doctor and another doctor, so there's no continuity of care. So there's no one doctor that can realize that this child is coughing badly. So it's very important that if you feel that your child has asthma, stick to one doctor. Make sure that he is able to give you a good advice. Do not go jump from one doctor to the other, because you need continuity of care. You need to also have regular reviews. As I said, sometimes just because your child doesn't have symptoms doesn't mean the child is cured of asthma. There will be circumstances where the child may need medicine that the child may need to take every day for the year to prevent a severe attack. So the parents need to know what are the red flags for asthma, what medication to give to relieve the symptoms, and what medication to give to prevent the symptoms. These are the three most important things. So what are the signs and symptoms of severe asthma? So a child who cannot talk, who's so breathless that they can't even talk. A child who's coughing continuously, right? A child who's coughing so noisily that you can hear the wheeze. The child goes, so you can actually do not need a stethoscope to hear the wheeze. It's so evident. A child who has increased work of breathing, so they have recession on their suprasternal notch, recession on their ribs. They go, so that are all red flags. When that happens, do not stay at home. Go to the doctor immediately, because the symptoms may get worse and the child may stop breathing. And the earlier you stop the progression of the attack, the better. So that is the recognition of red flags. You also need to know what are the relievers. Sometimes your child has asthma, you have a bit of cough, a bit of wheeze. You can try certain relievers at home. You can use an inhaler. This device, for example, an inhaler. This is a reliever. It has a bronchodilator. It helps to open up your airway. A big mistake among parents dealing with children with asthma is that they give this inhaler directly, like that. A child cannot do this. Even adult, I'm asthmatic to be honest, and in severe cases when I'm so breathless, I cannot take the medicine like that. I need a device to help deliver the medicine into my lung. I use a spacer. So a spacer is a device that helps the medicine stay in the chamber so that the child has time to suck in the medicine into the lung. It can be used with a face mask, and an older child who's able to use a mouthpiece can take the face mask out and use it directly. Never use the reliever directly like this. In severe cases, sometimes using this inhaler doesn't work, and you may need to give the same medicine through a nebulizer with oxygen, especially when the child oxygen level is low. That's why you need to go to the hospital for that. So that is recognizing how to use to relieve the symptoms. And lastly, as I said, how to prevent. We talked about exercise, reduce obesity, smoking. Those are non-pharmacological prevention. So medical prevention are normally based on or are inhaled steroids. A device like this, but rather than having a bronchodilator, medicine to open up the lung, the medicine has medicine that reduces inflammation in your lung. And this has different colors. It may be purple, it may be a red color that can be taken through a spacer or through a powder. For example, this device, where an older child, 7, 8 years old, use this device to take in the powder into the lungs to protect the lungs against subsequent attack. This is the role of the preventers. So we mentioned earlier, parents need to know how to recognize red flags, what to do, what medicine to use to relieve symptoms, right? And lastly, what medicine to use to prevent an attack.
Doctor, you mentioned all these, the inhalers and all these. These medicine have to be prescribed by a doctor, right? It cannot
Yes.
be, you cannot
No.
bring it.
You cannot go to the pharmacy to buy this medicine, because you need to know that the child needs the right medicine. There are many types. A doctor will examine your child and will be able to tell the parents what medicines to use. No, never go do Dr. Google. Google things and says, oh, this medicine, go to the pharmacy and get the medicine. You need a doctor not just to advise you, but also to monitor your child. Do not play with your child's life. Asthma is still causing children to die. It's still a serious illness if it's not controlled well.
Doctor, can we start taking some questions?
Yes, please, yes.
Regarding different topics? We have a question from Mr. Karim Gronat. He's saying, my children have always constipation, age 1 year, 5 months, and 2 year and 5 months. What are, doctor, the main reasons for constipation in kids, and how do parents should act when they have?
So constipation is very common in children. It's one of the most common things that I see in my clinic. The reasons for that can be multifactorial. The most common reason is diet. A child who doesn't drink much, who very picky with your food, do not take fiber in the diet. They have a diet that is poor of that lack vegetables, fruits, and they tend to get more constipation than others. Some children, their diet is perfect. They drink a lot of water, they take a lot of veggies, fruits, but they're still constipated. And it's thought that in these children, the constipation is due to the immaturity of the gut, right? So how do you manage this constipation? There are two ways to manage constipation. One, diet, and the other, medicine. The main thing is diet. Try and make sure your children's diet is optimum. And this means lots of water. Not fizzy water, but water. Make sure the child drinks about 1 to 1.5 liters of water a day, especially if you are in a hot and humid country. Secondly, you need to have a diet that has got lots of fiber in it. So make sure your child's diet has got enough fruits, veggies in the diet that can help to absorb water into the stool and makes the stool soft. Sometimes, if you have so much fiber in your diet, but you don't have water, that's bad. You need to have both. Drink a lot of water, have fiber. The third component of the diet is probiotics. And you can get probiotics from yogurt. Not yogurt drink, but actual yogurt. Yogurt, for me, is a magical food for your child. It has calcium, protein, fat, probiotic that the child needs to grow and to maintain a good health of your gut. In terms of medicine, there are many medicine that can be used to help constipation. I try to avoid using enemas. Sometimes I see a lot of doctors prescribing too much enemas in children, medicine that give through the bum. I try and avoid that. There are other medicines out there that can be used to soften the stool. Traditionally, they are osmotic laxatives. So things like lactulose. But now we have new medicine called Movicol for children. They can help the child pass motion slightly better. Other medicine that sometimes you have to use are medicinal probiotics. They may play a role. But just to emphasize, the main issue is your diet. There's no point giving if your diet is poor and the child is too dependent on medicine. Last thing, so we talk about diet, we talk about medicine. The third thing is physical activity. Too many of our children now are on their computer too long, are on their tablet too long, are on their phones too long. They should be encouraged to go out, to jump about, because that will stimulate the gut to pass the motion. So 3 factors: physical activity, diet, and medicine.
Doctor, we have another question about difficulties of sleep for children, especially when there's no physical reason or a disease that causing the kid to lose sleep. But some kids have insomnia, not a disease as insomnia, where people have a disease, they don't sleep. But some kids have some difficulties sleeping. What are the reasons of difficulty sleeping, and how can people improve the quality of sleep for their kids?
So sometimes when children cannot sleep at night, it can be due to multiple reasons. Worst case scenario, it can be due to an illness. A child cannot sleep because they are coughing at night all the time. The child cannot sleep is because they are passing motions a lot at night. The child cannot sleep because they have night terrors, severe emotional problem that cause them to have trauma when they sleep at night. But these are the severe ones. These are the minority. The vast majority of children who cannot sleep, normally they don't sleep because of poor sleeping habits. People from the Middle East, people from Asia sometimes are very bad at training the children in terms of sleeping habits. So it needs to start as early from the time when your child is a baby. Children need routine. They need parents to set boundaries for them. They need parents to tell them what is right and what is wrong. More often than not, parents leave it to the child to do whatever they want, sleep whenever they want. And they also inculcate bad sleeping habits in the child. The most common one now is the use of, again, phones, TV, screens that can interfere with the body's normal diurnal rhythm. So the child gets overstimulated. When the child gets overstimulated, they cannot switch off and rest in a normal way. So train your child. It can be, if the child has already got bad sleeping habits, it may need time. So for example, make sure there's a routine. Eat your last dinner at what time? Sleep, breathe at what time? Have a routine to tone down from as early as 1 or 2 hours before sleeping time, where the child is not exposed to stimuli. So 1 or 2 hours before sleeping, make sure the child doesn't get overstimulated. No TV, no handphones, no tablets, no loud music. Slow and try to calm them down with, for example, reading a book. And then make sure that they sleep at the right time every day. Have a routine. For example, bed at say 7:30, lights off at 8 o'clock, and then you may need to read a book for the child, and persevere with the same routine again and again. Make it second nature to them. Make sure that they stick to these routines. Also, try and discern and investigate if there's a need for the child to see a doctor. As I said, in very rare cases, the child cannot sleep for other reasons. If you have those concerns, see a doctor for an examination and an assessment.
Doctor, regarding this question, the parents of this kid who asked us the question, they said that their kid is 2 years old. They took him to a doctor. The kid is healthy. He has no health problems, but still his sleeping hours are very little. Maybe is it normal for kids to be this hyperactive? They're not sleeping.
So, if, for example, the child has been seen by a doctor, there's no physical issues, there's no psychological issues, there's no behavioral issues, because behavioral issues can range from autism to hyperactive disorder. So, in a child who has seen a doctor and has excluded all these possibilities, then it's mainly routines. Make sure that the child have a routine, a sleeping plan to try and make sure the child sleeps at the right time. Make sure the child is not hungry, not too cold, not too hot. Make sure the child, as I said, is not overstimulated. You need to have a plan on how to manage this. You look at the room that the child is sleeping in. Is the child sleeping in his own room? Is the child sharing a room with someone else? Or even case scenario, a 2-year-old still sharing the bed or room with their parents. So they need at that age to have your own room, sleeping in their own environment. So it is quite a complex thing, and very, very rarely you need to resort to use medicines. There are medicines out there that can help, but in children, some of this medicine can cause more harm than good. I myself try and avoid these medicines. So you need to have to, if things are persistent, you've done everything that I've mentioned, go back to doctor for re-examination and to see, is there anything that we have missed that's causing the child not to sleep well. I mean, as I said, as a last resort, you may have to resort to medicine, but that, as I said, is the last resort.
Last resort. Doctor, we have a question regarding vaccination from Mahmoud Abu Saloom. He says, hello, doctor, can I ask you about the catch-up vaccination for children? My son was born in February 2019. He had the first vaccine after the birth vaccine in June 2019. The third vaccine, which is 6-in-1 vaccines, he got in December 2019. Now we want to give him the third dose. Can we give him in this June 2020, or we need to start from the beginning?
So it seems that for this father, the son has been delayed in giving the vaccine. So in cases like this, for me and for many doctors, the stance is better now than never, better late than never. So you do not have to go through everything again. You just have to give the vaccine as early as you can. The doctor will advise in terms of the arrangement of the vaccine, how many more vaccines there is needed. Certainly, in most cases, you do not have to restart all over again. So this is one of the things that the parents sometimes have a misconception, that if they miss a vaccine and they've leave it too long, they have to start from back to stage 1, from the same vaccine all over again. No, you don't have to. You just have to go with a program of a catch-up vaccination. Different types of vaccine has a different program for catch-up. You just need to speak to your doctor and explain. The most important thing is do it now. Don't delay. Don't let it delay further. The earlier you get the vaccine, the better.
Dr. Hiro, I want to ask you about, we see a lot, especially in Middle East, you just mentioned, we have a lot of, it's not medicine, it's maybe you want to call it popular medicine. We have a lot of cases where mothers, especially parents, tend to give their kids some kind of herb drinks, like peppermint tea, we have chamomile, all these green tea sometimes. For you as a doctor, do you recommend these kinds of drinks give to kids from maybe, let's say, 3 to 5 years old? is there any danger or risk behind these drinks, or is it healthy? What do you recommend as a doctor?
So when you give herbal drinks, because we have that in Malaysia as well, different types of herbal drinks. They may not be tea based, but they are herbal nonetheless. You need to know what you're giving to the child. If it's just tea, then we know that too much caffeine, because you have caffeine in tea as well. So not just from coffee. Caffeine exists in tea. Caffeine is a stimulant. Caffeine is also a diuretic.
No,
So
I mean,
they
doctor,
make
it is called peppermint tea, but it's not tea actually. It doesn't contain tea at all. It's just peppermint.
So again, same situation as I mentioned earlier. You need to know what it is in the drink that you give. Because if it's tea, okay, for example, if it's tea is natural, right? Nothing chemical about tea. But too much tea can cause problems with stimulation and also passing lots of urine. If it's not tea, if it's something else, you need to know what you're giving, because as parent, as me, I'm a parent of 4, I've got 4 kids, I would never give things to my children that I do not know what I'm giving. So sometimes you have herbal drinks that contains bad things that can cause cancer. So you do not want your child to have cancer. So why are you giving those things? So sometimes this herbal drinks is marketed as herbal to encourage children to take it. So I can't give a specific answer because I do not know the actual content of the drink. Have a look, understand what it contains, and seek advice from your doctor. Okay, this drink has got this. Are they okay or not? Then the doctor can advise.
Okay, so anyone who is watching, please, before you give your kid any kind of herbal drink, any kind of drink you see on the market, on the shops, contact your doctor, ask him about all the ingredients before you give anything to your kids. I think we have another question
Because
here.
in Malaysia recently, there's many herbal drinks that, although they are targeted more to adults, that have found out to have cancer-causing agents. So they are marketed as healthy drinks, but they're not.
So we have to be very careful about this topic. Doctor, we have a question regarding nutrition for kids. We have a question here that a kid is only 3 years old. They eat very little. So the parent is asking, is it okay to give them some kind of protein shakes in their milk to improve their nutrition intake?
Okay. So I would not encourage you put things in the milk, because when you put things in the milk, it will change the composition of milk. One of the problems that you can come up with is sometimes the milk becomes too concentrated and you are giving the child overload of electrolytes that may damage the child's kidney. So if there's a problem with food, picky eaters is a very common problem that I see in my clinic almost every day. It is thought to be a growing up trait. It's not a pathological trait. All children, as they go towards the age of 2-3 years, they then discover some sort of independence. So they want to exert their independence. This is normal. Nothing doesn't mean that your child is naughty. It doesn't mean that you are a poor parent. This is just normal developmental behavioral issue that all children will have. Only that some children are very picky, some children are not that picky. Main thing again, as with sleep, you need to control what the child eats. The most common mistake that I see in my parents is the failure to educate our children what is the right food to eat. They let the children choose the food that they want. Now, as parents, it's very important. I believe this strongly, that you need to set boundaries. You can give the child choices, different types of food to eat, but you have to choose them. You have to be the person that gives that choice to the parent, to the child. You can never let the child dictate the food that they want, because inevitably the child will choose junk food, biscuits, chocolates that is not nutritious to the child, and it will perpetuate bad eating habits, and in the long term may affect the child's health. One of the common things that I see in children who's got very severe eating habits, in where the parents do not emphasize good eating habits, is iron deficiency anemia, and this can affect the brain development long term. So you need to make sure that the child is nutritiously. Some parents always say, doctor, if I don't give the child biscuits, if I don't give the child this, the child stop eating, right? Now, I've been a doctor, pediatrician for about over 20 years. I've never seen a healthy child who are affected because they are not able to eat what they want to eat, right? If they're hungry enough, they will take what the parents give. But once you give them things like chocolates, biscuits, bread, it gives you the wrong message. And the child will latch on to this and says, okay, I want this. I do not want the food, the nutritious food that the parents give. If I resist, eventually the parents will give this and I win. You cannot let that happen. Just as a precaution, if this becomes more serious, do see a doctor to make sure that there's no physical problem in the child to cause the child to be very picky with the food. Also, more importantly, so the doctor can measure and monitor the child's growth, height, weight, and advise you certain things that you need to do to prevent this. So protein shakes is not the answer for everything, and sometimes it can cause more bad than good. The Department of Health in the UK, recognizing this, knowing that picky eaters are very prevalent in the year twos and year threes, advise the giving of regular multivitamins every day to the child from birth until they are about 5 years old. Now, if your child has got a very good balanced diet, right amount of protein, the right amount of vitamins, the right amount of veggies, water, and all that, you do not need vitamin supplementation. But no 2-year-old, no 3-year-old does this. They sometimes eat okay, they sometimes don't eat okay, but they are growing. Their needs are still there. This is why I support the giving of multivitamins in children. I think it will help the children. The marketers of these multivitamins claim that giving these multivitamins would stimulate the appetite of the child. The evidence of that is not there. So you're giving multivitamins not to stimulate appetite. You're giving multivitamins to make sure that they don't miss on the essential vitamins that they need, especially vitamin D, when their eating habits are still not very good.
Doctor, we have time for one last question.
Yeah.
This is question from Miss or Mr. Mina Mohammad. He's saying, Salaam alaikum, doctor. My son always, after eating, he has some kind of pain in his stomach. Many times he doesn't feel comfortable until he throw up everything he ate. And every time after eating, he goes straight to the bathroom. What could be the problem or the cause of this situation?
So that habit doesn't seem to be normal. The child has tummy ache, going to the toilet, and it's recurrent. I would advise that the mother bring the child to a doctor for examination so that the doctor can examine the child's tummy, look at the child's growth, and if need be, sometimes do certain investigation. Check the urine, check the blood for infection, check the tummy for infection. Sometimes it can be as simple as constipation, diarrhea, acute gastroenteritis. And I think you need to have a detailed examination and investigation to come to a consensus of what's causing it. Certainly, it doesn't sound to be normal.
So to Mr. or Miss Mina Mohammad, doctor said that you have to examine your child. You have to take them to a doctor because it appears that what they have is not normal and it's not usual. Doctor, I think that's all the time we have for today. I would like to thank you so much for being with us today. Thank you so much for all information and tips that you gave for us and all the watchers.
So can I say thank you for joining us? Inshallah, we can meet up again and maybe we can talk about other topics and I can answer more questions that I'm happy to do.
Inshallah, doctor. Thank you so much.
And you can come to KPJ Damansara to see me.
Yes, we will put in the comments, we will put all the numbers, all the contacts for anyone who wants to contact Dr. Iqbal or who wants to ask questions or wants to have some kind of examination at KPJ Damansara. We put all the contacts and number in the comments. Thank you, Doctor.
Thank you so much.
لهنا بيجي نهاية البث أعزائي مشاهدين ومتابعين مجلات أسواق. نشكركم على وجودكم معنا اليوم متابعتكم والسلام عليكم ورحمة الله وبركاته.
السلام ورحمة الله وبركاته.